Welcome back to ECCMID TV with me, Michael Jackson, and our special guest here in the studio. Our next guest, a very regard, is a Hungarian to Professor, who is a professor of microbiologist at the Department of Immunology at El Ain University in the United States. Is your business card a ruler?
No, actually. Actually, quite a few of us living there.
Searching for the sun, sir?
The number of reasons why we end up there, but among others, an important one. As antimicrobial resistance, hunting ground, so to say.
Excellent. Now, you're working on MDR pathogens predominantly,
yes.
Is that correct? Just
well, we are mostly interested in gram-negatives, particularly what is picking up quite a few other guests of yours have already mentioned. And this is what mainly we are interested in, of these bacteria, different carbapenemases, in patients, how does it the Arabian Peninsula are very unique. They have a very unique demography. Percent of the population, it's like myself, coming from countries with a very, very high level on their own. And these countries in the peninsula are very interesting. Exactly, yes. And these clones and strains, and looking for new genes.
Resistance, as you say, discussed by the guests here.
The imprudent, not only in the hospitals but in the community. I think it's very important. The problem hasn't been given enough attention. Lack of education, lack of finances, lack of resources. The issue is that we move around a lot and we carry our bugs, and particularly in that part of the world where it's very common that we are abroad.
Yes.
Increasingly offering tourism hubs themselves. This all contributes to the spread of resistance, and
as you say, the region in itself has been fairly unique because a very closed, very secular set of populations.
Absolutely, and during the past, I mean, these are in '71.
Yes,
and one of the and since then, demography and with all of the positive as well as negative consequences. Very fascinating environment, and
where you're working with your fellow expert colleagues. You know, you've got great funding, great opportunities. The kind of work in.
An important point, I wish we had more awareness there. And this is actually one of the major tasks, is to generate more awareness. sometimes you feel that
Okay.
The seriousness. I think from ECCMID in that respect. I mean, we organized 2 years ago an activity at my university in Analain, and that was a huge. It's very important to establishing cooperations with scientists abroad.
Political acceptance or understanding or awareness, depending on which region that you're in. What about at the patient level? What about at the general populace level? A universal panacea.
Yep.
The aspirin treatments.
That's if you have a country, 80% of the population, that means that's a very hard problem, and so it's a very less studied aspect of the problem. So a lot of work is to be done because, as you said before, depends on what's going on in the community. Whether you have access to antibiotics over the counter, which in most of these countries by law you don't.
And yet there's grey markets, there's all kinds of things.
And yet you do to some extent. So, and there are a number of issues, and we're quite happy to see that there are now a lot of movements within these countries to improve this situation. And
excellent. I'm glad you've mentioned the ECCMID context as well, because obviously a forum of this nature, a congress of this size, literally brings together all the acknowledged leaders and experts, yourself and many of your colleagues from around the world. So this must be the ultimate forum for discussion and the catalyst, we hope, for change.
I fully agree with you, because it's very nice to see how many people from that region are attending year after year the ECCMID, and it's actually quite funny that with quite a few colleagues, actually, we bump into each other, and we actually have more, contacts here than you do back home. Than back at home.
Wow!
And it's absolutely true. Yeah. Actually, and I'm just giving you an example that we recently submitted, completed a work from 4 different countries of the region, and actually, this is where we met. To discuss how to proceed and how to continue. So
I'm sure the ECCMID board will be delighted to hear that. But
it's fact.
But it's not special. I mean, what you're saying is being repeated by many individuals who've sat here in the studio with us.
Yeah, and the attendance, I think, from the Middle East is increasing. The interest towards the event is continuously increasing, which is great.
And I'm sure so with more erudite talks and lectures and involvement and e-posters and everything else, we can raise the awareness of your specialist topic. Absolutely. And you're doing a phenomenal job by doing so yourself here with us in the studio. It's been a real pleasure interviewing you.
Thank you. It was a pleasure.
Thank you for taking time out of your busy schedule.
Thank you. Thank you very much.
Professor, thank you so much.